Now we have adolescence and the drug alcohol abuse. Adolescence and drug alcohol abuse. So adolescence is a period of adolescence is a period and a process during which a child becomes mature in terms of his or attitudes and beliefs for effective participation in society. Adolescence is a bridge linking childhood and adulthood period between 12 to 18 years of age. It is a very vulnerable it is a very vulnerable phase of mental and the psychological development of an individual. Okay, this is a very vulnerable phase. Then the causes of drug or alcohol use in adolescence. Curiosity and the experimentation. Curiosity and experimentation to escape from the facing problems, stress from pressure to excel in academics, television, newspaper, internet, etc. Need for excitement and adventure. Okay, unstable or unsupportive family structures and peer pressure. Then we addiction and the dependence. Drugs have an inherent addictive nature. Okay, smoking also leads the way to drugs. Tobacco containing nicotine and an alkaloid has been smoked, chewed or used as a snuff. Nicotine stimulates adrenal gland to release adrenaline and non-adrenaline into the blood circulation, which raise blood pressure and increase heart rate. They have inherent addictive nature. Drugs. Then the smoking increases the incidences of the cancers, emphysema, bronchitis, etc. Chewing tobacco also increases the chances of the cancer of the oral cavity. Smoking causes oxygen deficiency in the body as it increases carbon monoxide content in blood. Carbon monoxide content in blood smoking increases and reduces concentration of the heme oxygen. Addiction is a psychological attachment to certain effects such as the euphoria and a temporary feeling of well-being associated with drugs and alcohol. These drive people to take them even when these are not needed or even when their use becomes self-destructive. With the repeated use of drugs, the tolerance level of the receptors present in the body increases. Consequently, the receptors respond only to the higher doses of the drugs or alcohol, leading to greater intake and addiction. The addictive potential of the drugs and alcohol pull the user into a vicious circle, leading to the regular use from which she may not be able to get out. Then the dependence is a tendency of the body to manifest a characteristics and unpleasant withdrawal syndrome if regular dose of drugs alcohol is abruptly discontinued. It is characterized by the anxiety, shakiness, nausea and the sweating which may be relieved when use is resumed again. In some cases withdrawal symptoms can be severe and even life threatening and the person may need medical supervision. Effects of drug alcohol abuse. The immediate adverse effects of drug and alcohol abuse are manifested in the form of the reckless behavior, vandalism, and the violence. Excessive doses of the drugs may lead to coma and death due to the respiratory failure, heart failure, or the cerebral hemorrhage. The most common warning signs of the drug and the alcohol abuse among youth include the drop in academic performance, unexplained absence from the school, college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and the rebellious behavior, deteriorating relationships with the family and the friends, loss of interest in hobbies, change in sleeping and the eating habits, fluctuations in the weight, appetite, etc. At times, a drug alcohol addict become the cause of the mental and the financial distress to his or entire family and the friends. If drugs are taken intravenously, they much more likely to cause serious infections like the AIDS and the hepatitis B. The chronic use of the drugs and alcohol damages nervous system and liver, which is cirrhosis. The use of the drugs and the alcohol during pregnancy is also known to adversely affect the fetus. The side effects of the use of the anabolic steroids in the females include masculinization, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and the body, enlargement of the clitoris, deepening of voice. In males, drug abuse includes acne, increased aggressiveness, the mood swings, depression, reduction of the size of the testicles, decreased sperm production, potential for the kidney and liver dysfunction, breast enlargement, premature, the bardness, baldness, enlargement of the prostate gland, and these effects may be permanent with the prolonged. Then we have the prevention and control, that is avoid under peer pressure, education and the counseling, seeking, not sleeping, seeking help from the parents and the peers, looking for danger signs, seeking professional and medical help.